Profhilo, such a popular treatment at the clinic. Zoe is super keen to find out a little bit more about it, and hopefully we will go ahead and do a treatment. So you've had Profhilo before?
Yes, I have.
How long ago was that?
Oh, about 2 or 3 years ago now.
Uh-huh.
So I'm really keen to do it again.
What did you notice? What did you like about Profhilo?
Well, I liked the fact that it was quite subtle, but everybody who sees you says, oh, you look like you've had a really good night's sleep, or you look great. It's just a very subtle kind of dose of replenishing, rejuvenating hydration.
Yeah, that's it. Thanks. That's it. I'm done. All right. That's a wrap. Okay, so Profhilo is, I mean, it looks like a filler, right? And we should talk about that because that is a concern for a lot of people.
Yeah.
And it's injected. It's a clear gel. It's hyaluronic acid, which we all know. A lot of us are using it as serums on the skin. But so it does have. It is called an injectable moisturizer. It hydrates your skin.
Yeah.
Okay? It's hyaluronic acid. Hyaluronic acid, I mean, a lot of us use it in our skincare, serums, moisturizers, etc. But obviously that's only just sitting on the surface. So this is a way, Profhilo is a way to actually get it under the surface of the skin, deeper in the skin. We're injecting hyaluronic acid gel under the skin. So that's why it's called an injectable moisturizer. So that is what a lot of people, I mean, I would say it's about 50-50 within the first week after your initial treatment. A lot of people you will feel a difference. Actually, their skin, they might not see something immediately, but skin feels smoother, softer, and sometimes you can get that very quick kind of like brightening effect too.
Can I ask you, what is the difference then between a filler and Profhilo? Because they both are injecting hyaluronic acid.
Yep.
So what's the difference?
Yep. So, yeah, you're right. All the fillers we use at this clinic are hyaluronic acid fillers as well. There are other types, but the ones that, the most popular ones, so, Juvederm, Teoxane, etc., all hyaluronic acid fillers. You're right. So they have the same basic component. That's the main component of a filler. They look the same. It's syringes with a clear gel inside. But, there is a big difference, okay, in the structure, okay, and how when we inject Profhilo, you see little bumps under the skin, and it usually takes a few hours for those to go down as the product is spreading. And within a few hours, it coats the skin, so you have this even layer of gel under the skin, the hyaluronic acid gel, that then draws moisture in and hydrates and plumps and boosts your skin. Whereas a filler, it's much more exact, much more. When we inject a filler, it stays where we put it. Yes, sometimes we will massage and move it around a tiny bit just to get the right effect, but generally I think it's much more structured, and it will stay where we put it for up to a year. Profhilo, in it goes, it spreads, it's a much softer product. It's gone in a month. So this is why you had 2 treatments before. And this is why it's important, because that initial effect that we've discussed, the kind of hydration and absorbing water into the skin and that sort of quick boost that a lot of people get from Profhilo, I mean, it's great, but, for a month, that's not why we wouldn't do it just for that. The idea is to have 2 treatments back to back, so you have 2 months, 60 days of product under your skin there. And that, for most people, is enough to stimulate your skin, to just sort of trigger this process we call biorevitalization, where you're producing more collagen and better elastin, and your own hyaluronic acid supplies are better. So that's what then gives you that 6-month result beyond the life of the gel. The gel is out.
If I'm having Profhilo today, where would you suggest it goes?
So, I mean, Profhilo goes everywhere, right? Actually, can we bring Seppi in at this point? Who's going to do your treatment?
Hello.
And let's see your face quickly before you actually lean in there. Okay, so because Seppi, leads the way. I mean, she has injected Profhilo everywhere, right?
Yeah.
I mean, I've had some good results, stomach, but the main places that we inject Profhilo, where you see, really the best results, really, face, neck, and I guess décolletés are going more and more.
And hands,
and hands.
Wow.
So I think it's really important to say. I mean, there's so much hype about Profhilo, and we love it. I personally feel the best results are when you're sort of addressing crepiness, or that's a horrible word, but you know what I mean, like those early breaks that start when you're smiling, the fine lines here, maybe if the skin isn't quite as firm as it used to be around the mouth. These sort of early changes, I I think that's what it's very good at addressing, not so much wrinkles, right? So a lot of people come in and ask, can we have it here? Can we have it here with the lines on? It can help with kind of the extended crow's feet here, which we can't sort of, help with Botox or something, But I think it's more where the skin just, the neck, when you're just turning and starting to see it sort of not quite as firm.
So it's quite good for this.
Really good for early change in the neck. Unfortunately, it doesn't last as long as it does for the face or the neck. That's the very frustrating thing. But, fantastic for those changes when you're just, obviously Zoom. Yeah, you just see it, like it's just not quite as firm. We're always asked about age. Like it depends on you, your skin, your lifestyle, it's genetics, it's all of that. It's not about age. Yeah. So although I would say in terms of it, here we're all about sort of bang for buck, and really we want these treatments, everything that we recommend to deliver a good visible result. However, it is one of those treatments that, as it works as an investment as well, right? There's no one who won't benefit from this. It's a skin booster. We're putting a really nourishing ingredient into your skin. It's going to wake up, even from mid-30s. It's a great treatment. Can I hand on heart say, yeah, you're going to get an amazing before after? That's not what we do our treatments for anyway, but do you know what I mean?
No, but I think the subtlety is actually what you want.
Yeah. We're looking for just that little, you do get the glow, but it's more just it's your skin to be sort of firmer, a little bit plumper, a little bit more bouncy.
Yeah.
That's what I see. What do you, supple. Yeah. That's what we're looking for, right? So I think today, definitely let's treat your face, and then, let's see how you go with that, and we can discuss doing other areas, such as your neck. The other thing in the neck is that face, the treatment's very quick. It does sting. And you probably remember. Yeah, that's another difference actually with fillers. It does hurt a little bit more, but it does sting. But it's about 20 seconds where it just smarts, where it's injected.
Just like a filler does.
Yeah. Okay. And then you get these bumps, but typically on the face a few hours, and they will settle. They can last in some people a little bit longer, but most people 3 hours, they just go down, and then you're done, and you need to come back obviously a month later.
Sounds good.
Okay.
You ready?
Yeah, I'm ready. Yeah.
We're going to just clean the skin first, and then we'll get going, alright? Alright, there you go. Sorry.
So whereabouts on the face will it?
So it's 5 points per side. First one's just going to be essentially on the cheekbone here. Then afterwards just in front of the ear, above the jawline corner, then just above your nasolabial fold, and then under your corner of your lip essentially. Alright? If you're ready?
Mm-hmm.
So I'm going to start by the cheek first. I'm going to turn your head a bit to the right. Thank you so much. So a little scratch coming up. 3, 2, and 1. Here we go. Perfect. And a little bit of pressure. Doing really well. Excellent. And we'll come up. Is that okay?
Mm-hmm.
So next one along. You ready?
Yeah.
Excellent. Here we go. 3, 2, 1. Excellent. And the next one. Doing really well. Good. How are you holding up?
Yeah, that's fine.
Yeah?
I'd say minimal pain.
Yeah?
Amount of pain, yeah.
Perfect. Alright, so I'm just going to do the last 2 on this side. Here we go. 3, 2, 1. Doing really well. Excellent. And just one more here. 3, 2, 1. That's done on this side. Is that okay?
Yeah.
And then I'll move over to the other side. Alright, so we're going to do exactly the same thing on this side, alright? So first one's going to be here. Ready? Yeah. 3, 2, 1. I'm going to turn your head a little bit this way. Thank you. 3, 2, 1. Next one's here. 3, 2, 1. Alright, just 2 more to go. And just turn slightly more towards you. Thank you so much. Here we go. 3, 2, 1. And last one, here we are. Well done, I'm so sorry.
That's amazing, isn't it? So quick.
Yeah. Nice and finished, and you're free of bruising.
Yeah.
But will it take time to come up though?
You can normally tell.
Right.
Don't think you're gonna have any.
Yeah, I'd say it's like a sort of bit of a sting.
It's like a little bee sting.
So thank you, Dr. Seppi.
My
you.
pleasure, no worries.
How does that feel?
Yeah, well, it was pretty painless and quick. I mean, it was just a few sort of sharp pricks and then that was it. It wasn't unbearable at all. So what should I do now in terms of, could I wash my face, go swimming, have a steam straight after, would you recommend?
Swimming, mainly for the reasons that we've obviously created little holes, despite how small they may be. We just want to avoid any potential of infections coming across swimming pools. Yes, they have a lot of chlorine, but there's still a high chance of infection. So we would advise to avoid that for about 24 hours.
24 hours, okay. And what about putting on makeup or moisturiser?
Again, I would wait about 4 hours before any
Okay.
makeup. Again, same reason, we just want the skin to heal up before you put any product on.
Okay.
Same thing with moisturiser, just because unless you can guarantee that it's super duper disinfected and super duper
Yeah,
clean,
which we
just-
can't be.
Yeah, just best to avoid it for a few hours time. Despite the fact that Profhilo is thermodynamically stable, you can go outside, do backflips in the 40-degree heat and nothing will happen, whereas you do run those risks with filler.
Right.
We still would advise you to take some care and consideration in the aftercare.
And how long would it take till I start to see results?
So it does vary. Not everyone notices something straight after the first treatment, but quite a few of my patients usually say that after about 3-4 days they start feeling their skin is a lot more hydrated, looks a bit more dewy in the mornings. Some people, they don't notice anything until they've had the second treatment, and then there's a cohort of patients that notice something only once it's worn off. So it just depends on potluck which one you want.
So the second treatment in 4 to 5 weeks' time is the real sort
Ideally.
of, that's the... That's
Just to build up on the scaffold.
Yeah. I understand.
And just picking up on that, ideally yes, although we do have quite a few clients who only have the single treatment.
Oh, really?
It won't, and we sort of, initially we encourage a double treatment, to really see maximum benefit. But then I think with some we're just like, let's try a single.
It's a
And
bit of maintenance.
Yeah, but then you're looking at doing it every 4 months or so instead of 6 months, but it fits in for a lot of people. If they're coming in anyway every 4 months for other treatments, then we'll just add it in because it's a really versatile question. You asked me, how does it work with fillers and with other treatments? It is really versatile. And we do just almost add it on as just an additional syringe, whatever it is. So there's So we'll see you though again in 1 month's time.
Thank you very much.
My
Thank you.
pleasure. Thank you.